One thing that I think sets us apart from other hospitals is that our hospital, our organization, and our Chesapeake Regional Health Foundation never misses an opportunity in the community for any population in our surrounding areas that we can help or that we can bring resources to them, not just in women's services population. We did hold a diaper distribution in May. We gave away 7 pallets of diapers. So it was a total of 630 diapers, boxes of diapers that we gave away to those in need. And people are just so humbled and appreciative of it. The other thing we did last year was Baby Expo. Recently, new parents and families can come. We have tons of vendors. They can talk to anyone about baby proofing, health providers, anything you can think of for both mom and baby and family, all in one area. And they can network and start talking and just, receive a lot of resources there at the Baby Expo. One thing that we do here at Chesapeake Regional is tours of our birthplace. So if you're a mom who maybe hasn't decided an obstetrician or where they're going to deliver and you just want to vet our hospital, you can call 312-6508 and you can schedule a tour where you'll see the mother-baby unit, the nursery, as well as labor and delivery. We kept in mind when designing for the new postpartum unit to have excellent clinical excellence in each room, as well as comfort for every patient and their family. The room is state of the art and it's very comfortable, it's spacious. Especially a first-time mom, they're in the hospital 24 to 48 hours and that's it. So there's a lot of education that needs to happen. That includes lactation support, things from the neonatologist, the nursery staff, and the mother-baby staff. So what we did, instead of sending 80 pages of discharge teaching and discharge paperwork home, we developed a platform on iPads, and it's very personalized, and the moms can go at their own pace. They can interact on it. There's little videos that they can watch at their leisure. The Moms Mobile, we're bringing that back to where all first-time moms especially, we want to go out and see them in their home within 2 weeks of being discharged. It's going to be a postpartum nurse or a NICU nurse, and we're going to come to your home and we just want to see that you're doing well. And also we'll bring you a plethora of resources that you maybe know or don't know that you have there for you in our community. We want them to have the birth story that they want. We want them to come here, deliver their baby, and be able to tell about it forever and ever and ever, have a good outcome for both mom and baby. It's extremely important to us.
CHIPA Southampton Roads is a home visiting program, and so we provide parents and caretakers with a parent educator and registered nurse team who get a chance to come out and see anyone who has children prenatal up to the age of 7 in the home. We talk about milestones, development, connecting to resources, and just an extra level of support for them in their parenting journey. Because we know parenting is part learned and part nature. So us being able to come out and give you that guidance towards helping you be your child's first teacher is very important. It's hands-on, it's making sure that they are ready for school, that you understand their development, that you understand the needs of your family.
Parent educators, they support families day to day. We go out and we meet with the families twice a month in their home. And during the home visits, we focus on 3 areas of development during the visit. So we get to talk about the family well-being, and that includes like the mental health of the parents, the physical health of the parent. We also focus on doing an activity, facilitating an activity for the family, and that focus on more of helping the children with their milestones and making sure that they meet their milestones. And we also focus on the safety and nutrition. We follow up. So if the child is not feeling too well, or if the mom has got the child in school, we always follow up and we call the mom and check and say, hey, how did the first day of school go?
My parent educator has been a blessing to me. As you may know, I do have two special needs children who work me in certain milestones, both developmentally and physically. So with that, she has came in and gave me different charts on what they should be doing and what goals they should be reaching, as well as she has fostered my mental and physical health by just keeping me on track of what I need to do as a parent.
So parent cafes are a peer-to-peer support group, and they were designed to bring families and parents and guardians of children, and they are coming in to have some genuine, authentic conversations about their families and how they strengthen their families and the community. And those conversations are based on resilience. So we talk to parents about the importance of being able to bounce back when adversity hits or situations happen. We talk about relationships and the importance of having a strong family member or friends that can be there to support you in times of need. We talk about concrete supports. So those things that are brick and mortar, sometimes, friends can help you. But if your house was on fire, you wouldn't necessarily call your mother to put that fire out. You would call the fire department. So we talk about how important it is to have those concrete supports in place when things are happening. We also talk about communication. It's important to be able to communicate with your children, and not only your children, but those people in your community. When we're doing parent cafes, it is very interactive. We have a facilitator there, but we wanted something where people felt more empowered, and they were the ones that were taking the lead on these conversations and having conversations about things that really mattered to them.
What I like about the Parent Cafe is just the ability to network with different parents and see like how they are navigating through life, whether they're a single parent, whether they're married, whether they have someone, to make sure that I'm staying on track with my kids' development. So I would definitely recommend the CHIP program and the Parent Cafe to other parents. It definitely has been instrumental in my life as well as my children. My children look forward to going to Parent Cafe, and they look forward to my meetings that I have with my parent educator, because not only are they dedicated to you as a parent, they also are dedicated to the children and their well-being as well.
Say beep, 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 yay!
Bright Start, which started in 2004, and we serve the community of Crestwood. Many of our parents are subsidy, and this year is the first year that we received mixed delivery. And so in both cases, we guide our parents to those resources. We offer so many different components here in a child care setting. Nutritional assistance. Many of our children, this is their first interaction with other children. They are learning to share. They're learning to control their social emotions, learning how to be a part of a classroom setting. All of this will help them as they progress into a school-age child. We try to make sure that children have various opportunities that they may not have had previously. We offer tennis lessons. We brought in an art teacher who taught them art lessons. So we try to do things that maybe parents may not have the time because of work schedules, or maybe because parents may not know that these resources are available. We try to incorporate those types of things in our learning environment. We interact with the family and community engagement program with the school system. They offer workshops here at the center, helping parents to get registered for the upcoming school year. They also talk to parents about what a kindergarten experience will be like. I attend the Thrive conference every year, and I pick up on lots of different resources that the city offers. I share those resources with the parents, and we just try to keep them informed about what is available to them and their child.